officially call to order the Health, Hospitals, and Social Services Committee. We're going to begin with Resolution 2018-1281. The sponsor is Berkshire. It authorizes a grant to the Community Foundation of Middle Tennessee for the purpose of conducting a well-being survey of the residents of Nashville. May I have a motion?
Motion.
Okay, it's been moved and properly seconded. We have Mr. Hall with us here. Would you like to speak to it, Mr. Hall? You're working on this, and Mr. Sharp? Either one of
I
you?
can defer to Mr. Sharp in the health department.
That'd be great.
The money will go circuitously to Nashville Health, which is a 501c3. It was formed here. It's going that circuitous route because, and I'm not sure whether it's a state law or Metro's procurement requirements, they haven't been around long enough to meet some kind of standard, so we can't give it directly to them, but we have every faith that they'll do what they're supposed to do, which is raise the rest of the money, which is quite a bit, to do this survey, which will help inform the community health assessments that Vanderbilt, St. Thomas, us, the 4 FQHCs, and Metro Social Services are all doing, which will then inform the community health improvement plan for the entire community. So it's
wonderful. Wonderful. So does anyone have any questions? No questions?
So what's going to happen to the results of the survey once it's
keep it a
complete?
secret. No one will be allowed to see it.
Usually.
It will go to all these people that are doing the community health assessment, which is a collective effort. That's us, Vanderbilt, St. Thomas, the other people I know. It goes in the community health improvement plan. As to whether people can actually access the survey results, I would defer to Nashville Health about that. I assume so. It's going to be public. We're paying for it. So
There will be a public report on the survey, and again, as Mr. Sharp cites, the survey will inform long-term strategies, community-wide strategies to improve public health.
Who's going to produce this survey?
So the survey is produced by the Metro Health Department, and the data will be housed on a website and available via Health Department requests.
And so how do you gather the information?
So one of the CDC and the state will do under the CDC something's called a BRFS. You guys may have heard it's BRFSS, Behavioral Risk Surveillance Survey, Behavioral Risk Factor Surveillance Survey, which they do by telephone. And in today's day and age, you tend to get a lot of elderly folks that still have landlines. So we're going to do it by, help me, we're doing it
Online and paper to 11,000 households.
and by mail and some other things.
So how do you determine, I know you have in mind who you're going to survey, but how do you determine the people that you're actually targeting that is diverse, right? Because like you're saying, if you're 65 and a landline.
You want a reasonable cross-section of the entire community.
Right. So how do you ensure that?
You just old people that have landlines.
So it'll be a random sample, but then they will also oversample in certain communities where they haven't gotten as good response so that they can ensure response among certain demographics where there hasn't been as good response traditionally.
Okay, so are there going to be community meetings as well?
I'm sorry?
Will there be community meetings as well?
Community meetings when the results are available?
Well, I guess just kind of prior to, because I'm listening, I'm just thinking about millennials. I don't think that millennials fit into any of the categories you named, right? And then I'm thinking about people that maybe just, I don't know, it just seems like I don't know. Maybe I'm just assuming way too much. But just between landlines and
different ages, people of different races, all kind of whatever the characteristics of the community are, we want a decent cross section of all those folks.
Yeah. But I'm just thinking,
I guess she's asking, how is that going to be accomplished?
So the survey is not going to be done by phone because the response rate tends to be very low. And so it'll be done by mail, and also there's a computer-based option. People will receive a mailing where they can access the computer option. Is that right?
If they so choose.
That's not going to work either.
But in addition to that, we've got a communications campaign and a partnership with the Tennessean to promote people taking the survey and promote the public awareness of the
That's not going to work for a lot of people in those impoverished communities, the pockets of poverty, and it's probably would be best if you utilize something like they do with the census, when you actually go door to door to talk to individuals, to touch them and get the real sense of it. Because I think when you come back with things of this nature, the data is skewed to a different population of people, and you totally miss some people who most need the services that
Well, this will not be the only bit of data that goes into the community health assessment. There's all kinds of data that we collect already, that various metro agencies collect, that the hospitals have. There's a whole lot of stuff that goes into that. This is an effort to talk to the public directly on what their actual behaviors are. Do they smoke, et cetera.
Tom,
So are you going to include people like Matthew Walker? Some of those.
QHCs are all involved in the community health system. Yes.
And they'll all be stakeholders in communicating the survey and making certain that people are aware of the survey and that we're connecting with the right audiences so that we get, so that we do have a very diverse but comprehensive composition for the results.
Well, our position is not to oppose what you're doing or criticize what you're doing, but just trying to offer an opportunity and some suggestions on to really truly be inclusive in the efforts that are being made, because we see this happen over and over and over again, and the results come out the same. And so something has to be done differently. So for me, I'm just offering what I think works better.
Appreciate that.
to Councilor Hurt's point, are y'all going to be, I mean, the data obviously is available census-wise about how demographics break down. Are y'all going to be benchmarking off of the latest census data as far as those demographics
They'll
go?
look at census data, they'll look at the communities, what is it, the one they do the interim ones, the
ACS.
community surveys. All of these data sets will be a part of the process. Not necessarily the survey, but a part of the overall look at the community health assessment. So you look at everything you can find.
Okay.
And I understand your point. I understand the point. There are certain areas, there are certain demographics that are harder to get information out of.
Right.
We get that.
Right.
The folks that will be doing this survey certainly know that.
Right. But just like our SSP program, the numbers that have come back, it was overwhelming for you all, but not for us. Because we understood, we were there and we knew what was actually happening. So, and that's the kind of thing I'm speaking of.
And I would just hope that there are checkpoints along the way to say, you know, if we're X amount of days or months in and we know that we're underrepresenting a population, how are we going to change our outreach strategy to that? I've been in your shoes. I know that it's tough, and sometimes you have to change course.
That's what we're paying these guys.
We had Council Lady Van Reese.
Yes, and I'm going to have to skip out in a second, so it's not because of you. I wanted to bring to your attention also the minority chambers, as well as just council members at large, because not only will the members, but their employees and their families, I think that's a really good way to touch back. And with their recent inclusion into the Metro budget, they're going to be very anxious to be as responsive and helpful for studies like this. In particular, as a founding member of the LGBT Chamber, back when it wasn't even called that, the idea of in your surveys is having a self-identification option for LGBT, so that if they want to self-identify, that there's an option for that, and I would encourage you to include that.
And before you take off, Nancy, so this will be a part of a much longer and larger process. But once we get to the Community Health Improvement Plan, that doesn't belong to the Health Department or Nashville Health. That is the community's health improvement plan. You guys will be offered all the opportunities you want to participate.
Yeah.
And whoever, I mean, we get thousands of people.
Well, I'm one of the ambassadors for the All of Us research program and the Pride study, and so there's already been some really proactive efforts through the minority chambers with that NIH and CDC funded thing. So I think that there's a precedent there that you guys can absolutely benefit from.
I think that's great information. Yeah, and I guess, I think that's great. That's what I was going to suggest as well, because the Tennessean, right, only certain demographics of people read that. And we just want to make sure that we touch as many people as because we are all Nashville, and sometimes certain groups get left out. And I'm not just talking about African Americans, but we want to make sure that we can touch as many people as possible to be as inclusive as possible. Is this a part of the 2020? The overall federal government 2020?
No, this is something that we do it. We have traditionally done the health assessment and the community health improvement plan every 5 years. Vanderbilt and St. Thomas have to do it as a part of their community benefit for their nonprofit status. It's an IRS requirement.
Okay.
They usually do theirs every 3 years. Our years happen to coincide this year, and so we're going to do it with them, along with the 3 FQHCs, which is Matthew Walker and United Neighborhood Health, and Connect Us.
What's the fourth one?
There's only 3. I got an extra finger up there.
Okay.
And Metro Social Services.
Okay.
Because they do that annual report, so they have some skills in this thing. But it's a really involved process. If you've never seen it, I encourage you to go to healthynashville.org and look at the 2015 Community Health Improvement Plan. It's a really interesting document.
Sounds good. I think everybody's expressed all hearts, minds clear. Are we ready to vote? How many for? All right, seeing none against and none not voting, it is recommended to the full body for approval. Thank you so much.
You still have a quorum without me, so I'll go.
Yep, thank you for coming. We appreciate you. All right, on to the next one. Thank you for being here. The next one is Bill 2018-1201. It's Schulman. It amends the Metro Code of Laws regarding animal control regulations. May I have a motion?
So moved.
Second.
All right, Councilmember Schuman, you want to come and?
Oh, well, thank you.
Yes, come
I'm
and
going to sit in
share
front
with
of
us
Tom
about your
Sharp, so
bill.
I can't say anything bad about my bill.
Yeah.
So, like the rest of council members, we get emails every so often, particularly when it starts getting hot outside, about people with their animals that are outside when they shouldn't be, and people go berserk. So we got several of those recently, and so I asked Mike to take a look at it, and we ended up with a bill that took the temperature reading from 95 degrees down to 85 when you have to get certain types of pets, particularly females who are pregnant and so forth. You have to either have somebody outside taking care of them, or you have to get them inside. You also have to stop if it's a certain temperature. You can't tether them outside. We always have concerns about animals, just like we have big concerns about people. And a lot of times you feel like if people are treating animals poorly, they may, there's a cause or a concern that should be out there as well. The problem with this bill is that it has a big fiscal impact on it. It's costing, based upon the estimates out of the Department of Health, it's supposed to cost, if we took the temperature down 10 degrees, it would cost the city approximately $500,000 to get more people in there. So I talked to Tom Sharp yesterday, and Tom, I don't know if you had a chance to get any of the statistical data. I was just looking for it. I don't know if you've had a chance to see it.
I'm going to get you the call logs, Jim. I didn't
Okay.
get it today. I'm sorry.
Okay, that's okay. So part of the thing is, I think we all hate this. I mean, I hate the fact that you drive around, or people drive around and see animals that are out there with no water, and it's basically 94, 93 degrees outside. So I think what I don't want to push this because we won't be able to do it. And, if we pass it, it could be in the code, but they don't have the people to do it at this point. So I think what I need to do is defer it indefinitely, but with the understanding, and I'd have to look back to Mr. Sharp, is that I wouldn't mind sitting down with the health department and with the people from animal control and figuring out if there's some better way to do all this. Nobody wants to see animals suffer. Nobody wants to see people suffer. But there's got to be some better way to do this. And I don't know if another city has a better method. I talked to a couple people who are big animal activists, and they said, basically, animal control is doing the best that they can. But as the city grows, if it's not as good as we should be, then maybe we need to do something else.
Okay, thank you. Are there any questions or comments from the committee?
I would move to defer this indefinitely.
Second.
All right, so it's been moved and properly seconded to be deferred. We appreciate you coming and explaining. Thank
Sure,
you so
thank
much.
you.
All righty, thank you. This concludes our meeting. Thank you so much.
Mr. Sharp, you okay with
Yes, sir.
We need to take a vote, but all four?
Oh, yeah.
Okay.
Councilman Schuman.
it? Yes, ma'am.
You need to have plans.
That's simple enough.